So what we've been doing is working with public and private sector partners to increase testing and contact tracing. Testing is widely available. That is not a constraint. So if you need a test or you just want a test, you can get a test quite easily. And we have a list of test sites at louisvilleky.gov. You see this on the screen right here. And you recall back in the early days of the test, it took quite a bit of time to get results. That is not the case now. So there's plenty of tests available. You can get the results very quickly. Today, results are often coming back in 24 hours. We've also expanded our public health department to deal with the virus more effectively. We now have almost 300 contact tracers to help people who test positive and to also let others know if they've been exposed so they can isolate or quarantine as needed. And if people need resources, a place to stay, some food to help them get through the isolation or quarantine period, there are ways that we can help with that as well. Now, we're doing all this obviously because we don't want more people to get sick, and we don't want more people to die. And we also don't want our hospitals to be overwhelmed. We're starting to see that in some cities around the country right now. Our hospitals currently do have capacity. That could change. There's not as much concern with the number of beds as there is staffing availability for nurses and doctors to deal with patients that have COVID. So that's why we've got to all be working together to take responsibility for keeping this COVID-19 in check. Last month, Governor Beshear announced some guidelines to help do that for communities in the red zone. So we want to remind people of that. And again, ask the media to post these. We know it's not new news, but we're not getting the results that we need. Maybe that's the news. And so we need to continue these type of basics. Remember, if you can, telework if possible. Government offices that don't provide critical services are operating virtually. Reduce in-person shopping, order online, or pick up curbside as much as possible. Just be thinking, the more you can restrict your interaction with other people, the less chance the virus has to spread. Order takeout, avoid dining in restaurants or bars, but always leave a big tip. Prioritize businesses that follow and enforce the mask mandate and guidelines. If you've got an event, please reschedule it or postpone it. Don't bring people together. Don't host or attend gatherings of any large size. We'll be talking about Thanksgiving here in a moment. And avoid non-essential activities outside of your home. Reduce overall activity and contacts. Still exercise. You can go outside, no problem. If you're not around people, you don't need a mask. And so you want to keep that part of your routine going as well. But those are the things that we can do to make sure that the virus is not spreading. We also want to talk about young people. If anybody thinks that they're below a certain age and healthy and it won't matter if you get COVID, we know there's been lots of reports that is not true. And I wanted to share a description of the disease from a member of our team here at Metro, a person in their 30s who said, it was like every kind of sick I've ever been all at the same time. The worst cold, the flu, a stomach virus, and all my allergies hitting me at once for weeks. So this person now has recovered, thankfully, but this is still an experience we'd all like to avoid and avoid giving it to others, some who could have even more severe and even potentially fatal reactions to the virus. We're over 400 deceased in Jefferson County since the beginning of the virus. We obviously do not want any more. So let's talk about that and more with Dr. Sarah Moyer. She's our city's chief health strategist and director of public health and wellness. Dr. Moyer is going to run us through our public-facing dashboard right now and offer some comments. Dr. Moyer.
Thanks, Mayor. Just want to repeat what you've been saying. The time's now to renew and strengthen our commitment to fighting this virus together. I know a lot of you are doing the right thing, and you've been sacrificing over the last year to protect yourself and also because you care about others. So thank you, and please don't give up. Stay strong. We can do this, but it's going to take all of us. So getting to the dashboard, we are, as you said, in the red. We still have uncontrolled spread in the community. That is really red. So being in that red zone, want to make it clear that everyone in the community is at risk for catching COVID or spreading it to your friends, family, and coworkers if you let your guard down. recording a new record amount of COVID cases weekly. We are at 2,300 this week, which is about the same as last week, record numbers since the start of the pandemic. And it continues to surge in our community. A majority of our cases come from household contacts, but that means that someone is bringing the virus into the home before it can spread to other family members. So just please be careful, especially when you're going out to sports teams and churches, event venues, bars, restaurants, other businesses. Make sure that you are following the red recommendations. Our deceased, we've had 24 new deaths reported in the last week. And these have been in individuals ranging in ages from 58 to 97. I want everyone to live as long and as full of life as possible. These people were cherished family members who are missing this upcoming holiday season and years to come. So let's please do all that we can to stop the spread of the virus and prevent further deaths. Our rolling testing positivity is 6.7. This is too high, and it means that we're missing new cases. So now's the time to sign up for a test if you're having any symptoms like headaches, fatigue, congestion, loss of taste or smell, or you've been a close contact to a case, or if it's been a week since you last did a risky activity like having friends over for a Halloween party, going to a wedding or a crowded bar. We still have plenty of testing capacity in the city, and more sites are getting added weekly. So please check out our website and sign up for a test. I know many of you have enjoyed going out to Blue Water Southeast Christian site that has not required signing up ahead of time for an appointment because that's become so popular and traffic and throughput have become an issue. They are going to be switching to an online sign up in our blocks starting this evening. So please get online and book the time you think you'll be out there. And if that site's full, there are many others that still have availability across the community. For our hospitalized patients, you can see the case counts. As our case counts increase, so did the number of hospitalized patients, just slightly delayed. There were 270 as of yesterday, or 259 as of yesterday. These numbers are the highest numbers that we've seen since COVID began. And as you said, Mayor, hospitals and our healthcare system have capacity right now, but they are beginning to see staffing challenges. Healthcare workers are being exposed to COVID-19 outside of their healthcare setting, which then prevents them from coming to work. So if this rapid growth continues, and if, as expected with colder weather and people going inside and getting together with Thanksgiving, it means it might only be a few short weeks before our hospitals have staffing challenges. ICU patients also at the highest that they've been since the pandemic started, 62 as of yesterday in the ICU and 38 on ventilators. Next down is our zip code map. We continue to see COVID in every single zip code. And just looking at the demographics, there's a higher rate of COVID cases among our Black and Latino communities, but in the last month, the largest increase continues to be in our white populations. And then the latest newest feature is our incident map. It starts in June, and you can see it going through there how over the summer we were in the yellow and red and slowly became orange. And as we get into October and November, the entire community has turned red. So please be careful no matter where you live. And we all really must be doing what we can. If you can stay home, that is what we're recommending right now. Switch your shopping back to online. Work with your employers to make sure they're following the red recommendations, and we will get through this together.
Mayor, you're muted, Mayor.
There's a couple questions.
Okay, sorry. Sorry about that. Just for some comparative data on hospitalization, on October the 1st, we had 95 people in the hospital with COVID versus the 259 we have now. We had 23 people in the ICU versus 62 that we have now, and 19 people on vents versus 38. So you can see the rapid increase that we've got taking place. It's not exponential like you see in some other cities, but it's certainly doubling and can kind of really put the highlight on what the trend is and the problem that we're having. So with all that in mind, Doc, what are some of the things people need to do to adjust to these rising cases that we've got going on?
So first, we really must protect our home and those that live in it first. So please refrain from attending public spaces and events like bars, tattoo parlors, gyms, sports practices, events, weddings, funerals, parties, those sorts of things. We're seeing the most spread happening if you don't have a mask on, what's hard to do while you're playing sports or eating or drinking, especially with alcohol involved. And then, as we know, even activities that were low risk before are becoming higher risk now, like going to the grocery store or getting your hair cut. All those are becoming less safe. And so, I mean, I guess, yeah. And I also want to add to that, too, is we are about 2 weeks out from Thanksgiving. And so just really encourage everyone to start planning today. The safest way to spend Thanksgiving is with the same person you've been spending dinner with every night this month. But if you must travel or have other family and friends, please start tomorrow quarantining for 2 weeks prior and recommending everyone get tested 2 to 3 days before traveling. And so that means anyone who's planning on expanding your bubble for the holiday season to really start thinking about that now. And then employers as well, please, now is the time. If you did telework back in March and April, and now is the time to reinstate that again. Please allow your employees to work virtually as much as possible and postpone or reschedule any in-person training sessions and meetings that you have on the calendar. And so, yeah, as a physician, public health leader, preventing suffering from illness and preventing death is always my first priority. I have faith in our community and have hope that the situation will improve. We've had a lot of good news come out over the last couple of days. And so start planning and thinking about next year's Thanksgiving with all your family members that you love, because I believe we can do this together and we can stop the spread together as Louisville.
Doc, yesterday we had mentioned the kind of promising news from BioNTech and Pfizer about the vaccine. So can you comment a little bit about the vaccine development, other vaccines? Are we getting closer? When we start expecting to see some vaccines locally?
Yeah, so the news that came out yesterday, very promising. They're reporting over 90% effectiveness, which is much better than other vaccines that we have on the market now. So it still needs to be okayed by the FDA before it's out to the public. And I think they have about 50 million doses ready to go. So cut that in half, that's about 25 million people that can get vaccinated. And we know first priority is going to be our healthcare workers and then our first responders and then those with chronic medical conditions. But hopefully by next year and before next Thanksgiving, the other vaccines will be coming to fruition as well too. And we can look forward to a better Thanksgiving next year.
So we really are looking at a rollout through full 2021. This is not something that's going to be over in the coming months.
No, I don't see, we need about 70% of the population vaccinated in order to get that herd immunity to prevent the spread that we see happening to get back to our old normal lives. So I don't see that happening before this holiday season, but am hopeful for next year we will.
Okay. And then do you expect anything to change? I know it's still 70 plus days away or so before President-elect Biden takes office, but yesterday he announced a Blue Ribbon Advisory Board. Do you expect, what kind of changes would you expect to see there?
I'm hopeful that we'll get a national unified response, so there'll be less confusion kind of across state lines and counties about what the best measure is to prevent the spread and keep our community and loved ones safe. I don't know if it'll, here at public health and wellness, we're going to continue to do what we've always done and making sure our response and decision making follows the best science and are protecting those that maybe are not able to protect themselves, whether it's their workplace or where they might live. But I'm mostly excited about the unified approach that's hopefully coming down the way.
All righty. Okay, and then you mentioned Thanksgiving. We're 2 weeks and 2 days out from that. Any recommendations for that?
Yeah, so safest recommendations to stay home and eat with the people you always have dinner with, and people you know have been following the red recommendations. Videoing your family and friends while you cook and eat, and drop off your favorite dishes at their house, and don't eat with them in person. Second, safest is to know your risk. If you're in a high-risk category or work with people in high-risk categories or really worried about the long-term effects from COVID, would rethink and maybe go back to that safest option. But if you still want to get together or need to get together, I know there's a lot of people that still want to, still need to travel. Some ways to make that safer is to start quarantining tomorrow, so 2 weeks before you travel or head to dinner. If you need to go to the grocery store, get that all done tomorrow before you start that quarantining. Any other errands that you might need to run, talk to your boss about working remotely or taking time off. And then next is to get tested. So recommending testing kind of 3 days before you travel, especially if you're getting on an airplane or in a car with people you're not normally with, stopping at gas stations. Want to do that 3 days before so you're going to get your result back in time. And most importantly, don't leave if you don't have your result. Stay home if that result is positive or if you get sick after you got tested. And then also with testing, recommending testing like 2 to 5 days after people get back. And then while traveling, while with family and friends, if you're not around the people you're always with, please just make sure you're wearing a mask and are spacing 6 feet apart. Wash your hands often. Recommend staying in a hotel or not in the same vicinity as others that you're not normally around. And then for dinner, make sure you're spacing seats 6 feet apart. Outside if possible. Hopefully the weather stays nice like it has been. And then just if any questions, I know it's a lot of information, a lot of ways to reduce the risk. So please keep checking CDC's website. They have great recommendations about Thanksgiving and are updating them daily as well. And if we follow these, everyone will be here to enjoy next year's Thanksgiving and years to come. And so just really, I know people are probably down about this year looking different, so just start dreaming about next year, and hopefully we can enjoy that with all our family and friends together.
All right, folks, so you can see how serious it is, and the requirement to have a plan to do this safely is obviously never been more important. So you can find all those guidelines at the CDC website. So we'll go ahead and take some of the media questions that are in now relative to the comments that have just come up. So Jean, do you want to facilitate that?
Sure. Marcus Green from the DRB is asking, given that we're in the red zone, do you think it's responsible for the KFC Yum Center to reopen for basketball in 2 weeks? Mayor, would you like to take that one?
Sure. I mean, their plan, U of L's plan has been approved by the governor's office on that. Remember, the participation, I believe, is at 15%. So there'll be about 3,000 people in the Yum Center. So as long as they're spaced appropriately and as long as they're not bunched up when they're coming into the Yum Center, it should be fine. If they don't follow those practices, obviously that's a danger, but that's an example of accommodating to this new reality we're in with just 15% attendance there. We will be finding out, obviously most sports have been outdoors so far, which has been helpful. When they go inside now, we'll be learning to see if still that same 15% is going to have the same positive benefit.
And Dr. Moyer, Carrie Grace of WLKY is asking, how safe are those igloos at 8 Up when it comes to safe dining?
So the igloos, I mean, I think it's safe if you're eating out with your own family and people that you're around anyways at home. I think if you're in a enclosed area with people you aren't normally with, they're probably less safe. I know Nick Hart is on the line. I don't know, Nick, anything you want to add about those?
Yes, Dr. Moyer, I think that you hit some of the key highlights. And when we look at small confined spaces, the best guidance we have is from the CDC's guidance on hotel use. We know that we gather in those small confined areas, we're going to fill that with the respiratory droplets that transfer COVID-19. And so I would say that you're taking some extra risks if you're sharing those spaces and they have not been decontaminated between users. And so we want to make sure that those areas get fully ventilated. The air is moved out of those igloos. All the surfaces inside it are decontaminated to remove any droplets that may be on hard surfaces that could then infect the next user.
Let's go ahead and segue to Nick. He was up next here on our presentation, and we can work these questions in as we go along. So, Gene, however you want to facilitate that. But another aspect of our work to beat back the COVID is the health and wellness team work with businesses, particularly those that have been really hit hard by the disease, like bars and restaurants. And restaurants are a huge part of our city and the culture of our city, the whole urbanism experience that we have. So these are environments, though, where we've seen people catch the disease. At one point, it was kind of the leading area. Now it's inside the household where people are catching it. But restaurants and bars are critical to the economy of our city as well. So we want to do everything we can to help them stay open safely. And Nick Hart is our environmental manager with public health and wellness. And so he and his team have expanded compliance and enforcement work. So Nick, what are you seeing in terms of any kind of strategic changes that you and your team have made in response to the surge in cases? And what are you seeing as best practices out there?
Yes, Mayor, we are taking it very seriously. And to communicate that, we want to make sure that our community knows that we're stopping pretty much all of the routine inspection activities that we would normally do and take for our community to keep the safety up, because COVID is the primary concern that we have in our community, that it's affecting our public health right now. So there are some activities that we are not going to be able to dismiss, but I just want everyone to know that we are transitioning. So the majority of our environmentalist time is going to be focused specifically on COVID. So what that means is that any activity that we are not dismissing, like foodborne illness investigations, indoor air quality inspections, school facility inspections where people are still going into school, a large component of that is going to be focused on COVID compliance, and there's going to be a COVID assessment on that. We have been doing that with many of our inspections in the past, but now our entire division is going to integrate a COVID assessment as part of their activity for any inspection or investigation that we can't dismiss. So as part of that, we are pretty much quadrupling the amount of time that we're going to spend on evening, late night, and weekend surveillance. Each of our environmentalists is going to dedicate some time during the week for evening, and then we're also creating those strike teams to go out for late night surveillance, as well as events and weekend activities. And we're going to be focusing this surveillance on those peak operation hours. So we know that is the crucial time that encourages large numbers of people to congregate in shared spaces. And because it's going to be peak time, we may not be announcing ourselves to operators. You may not know that we're there performing surveillance. And we may be doing follow-up via mail or a phone call afterwards. We're not trying to disrupt business, but we also are trying to get a realistic idea of what it looks like during the times we see the most people out in our community. We're also going to start shifting to be able to focus more on public health permitted facilities and activities. So there's a lot of businesses out there that we don't regularly work with. I want you all to know that we're going to be visiting. We're going to be observing your operations, especially those operations that are customer forward, serving the public on a regular basis. And then last, I do want everyone to know that if we do have a violation that we have observed, we are going to reach out to that organization, and we will be doing follow-up inspections to ensure that violation is corrected. As part of that, we talked earlier about we want customers to seek out companies that are doing good precautions, that are following these guidelines. So we are looking at we plan to publish a violation list on LMPHW's website And so you'll be able to see who has received violations because they're not following Healthy at Work guidelines and that they're not following those face covering guidelines. So I do want to do a big shout out to our partners over at Alcohol Beverage Control. There is a statewide push that is providing guidance to this organization. They've been our primary supporter. They're helping us with compliance on a daily basis. And I do want everyone to understand that both LMPHW as well as the ABC does have regulations out there that says if we think that a public health threat exists or there is a public health threat that's being created due to behavior inside an organization, that does give us an opportunity to look at those operating permits and see if that needs to be addressed. Those operating licenses need to be pulled because we are having reoccurring large impact public threats occurring at organizations. So with that, we do have a slide. I do want to make sure that all the businesses have the resources that they need to continue operating. This should not be new material to everyone. In fact, Healthy at Work does say that if you are going to open, you're going to have employees and you're going to be serving customers, that not only must you meet these standards, but you must maintain these standards to stay open. So if you cannot meet or maintain these standards, businesses or operations, whether they're nonprofit, volunteer, for-profit, if you can't meet the standards, you have a self-imposed obligation to not perform that activity. So these resources we have developed and published on our website, our environmentalists will be carrying them around with them to be able to give to businesses. And we have great guidance that has condensed the information provided by Healthy at Work and made it much easier to use. So we have that general business guidance. We have guidance that if you have an employee who's come to work or a customer who's been in your establishment who's been sick, how do you need to go about identifying those people who need to quarantine and isolate? And then great checklists for businesses and event planners and other organizers that they can go through step by step to make sure that they have the right precautions in place.
All right, Nick, there's a couple questions for you from the media that Jean is going to give to you.
Yes. Marcus Green from WDRB asks, what are some examples of the types of businesses that Metro normally doesn't work with, but that will see increased enforcement and surveillance?
So we generally don't have a lot of opportunity to go into office buildings. We will be taking opportunity to look at large employers and to check in with them. Hair salons, spas, many of the retail outlets. And so, you know, we normally go into Walmarts, but we generally stick with the food retail as opposed to the rest of the retail in the organization. So places where people are going out, where they're shopping, right? Where they're meeting up to, you know, essentially congregate and check in with one another. Community events. A good example of this was the car show that came back in the summer. We'll be looking at those large gatherings now and making sure that we have a presence there. We've been going to a lot of private clubs and country club type scenarios to check in on people. So I know that you're not used to seeing us. In many cases, if we do come in to discuss operations with you, we will identify ourselves. But I want everybody to know that because we have a very large city, we're trying to make sure that this enforcement for compliance is equitably spread across the city, so everybody's getting guidance, and then we're having our eyes on everything. We're going to do this in the most efficient way possible. So we may be coming into your establishment, making observations, recording those, and then quickly moving to the next establishment, making observations, recording them, and then coming back to the office to be either followed up in mail or on phone call.
Paul Miles from WHS Radio had asked about more details on the business list and when it would be published. Kathy has followed up with the answer that we're going to send out, or you guys will be sending out those businesses that we've received complaints on, investigated, and issued orders for correction via our press release weekly starting next week, and then we'll be publishing our press releases on our website. And I think those are all the questions for you, Nick, so far.
I'd just say too, if people see violations, Nick, they can call 311. Is that right? Is that the best way to report it?
Absolutely. 311 is a great way. I do want everyone to know that they get a lot of phone calls. If you use the email in function for 311, we are absolutely going to get your phone call. That's the best way to transfer your concerns to us. So there are multiple methods. If you're calling, you can't get a hold of someone, make sure you're using that email module.
All right.
And before we move on, Mayor, I'm going to go back to a couple of questions that we didn't hit earlier. I think for Dr. Moyer, Carrie Grace from WLKY asked how many of the deaths are COVID only versus complications of COVID?
All of the deaths are reviewed and vetted by Committee of Public Health and medical professionals at the State Health Department. So all deaths are usually a combination of factors and not just a single cause, but COVID-19 would push someone to mortality when they otherwise would not have, when they would have maintained their current health condition. So we know some chronic conditions predispose you to poor outcomes with COVID. So it's a combination of all of them, but all of the COVID deaths, those people would have been alive today if it wasn't for coronavirus.
Thank you, Dr. Moyer. John Boyle of WFPL has asked, and I guess, Mayor, this question is for you. Would Metro government consider enacting stricter localized restrictions in the absence of further restrictions from the governor?
Well, the kind of programs that Nick just described to you there, what we can do locally with more enforcement when we have permits and licenses, that's kind of the leverage that we have for compliance. And what we're seeing, obviously, is there's plenty of regulations out there in guidelines, but people are not complying. So that's really when this thing will come into control, is when everybody starts doing the right thing relative to the virus. So hesitate to do, more regulations, more of this if people aren't going to comply. But we will be exercising more resources from our public health department for oversight and enforcement. All right. Let's move now to our final speaker. And that's going to be from a health equity perspective here with COVID-19. Metro government's been working for years to improve health equity in our city. Our Center for Health Equity was one of the first in the country. It was established in 2006, and it's a great national model for how to understand and address racial disparities with health. So I'd like to welcome Rebecca Hollenbach with us right now. She's the executive administrator at our Center for Health Equity. And Rebecca, the center has produced something to help us fight against COVID-19 and the fight for health equity. If you want to share information about our new COVID-19 care kits.
Thank you, Mayor. Good morning, everyone. What I want to share is that from the beginning of the pandemic, Center for Health Equity, as part of the COVID-19 response, has really been trying to think about what is the best way to support our residents. We know that this is a difficult time. We know that we're asking you to uptake a lot of new behaviors, right? So isolating when you're sick is something that we don't always normally do. And that can last for a while, right? That can be about 10 days or more, depending on your symptoms. And we know that that can be difficult, that can be scary. And we want to find ways to be able to support all of our residents. So we've developed these care kits. They're based off of different things that other countries have done, other medical providers have done here nationally. And so what happens is we will get information on someone being a positive case. It will come into our contact tracing and tracking system. As soon as we get that information, we are sending people out to hand deliver these packages. They look like cardboard boxes with a label on them that show that they're from Public Health and Wellness. And inside, we have materials that can help keep you safe during your stay, during your isolation, as well as hopefully alleviate some stress and make your isolation experience a little bit better. So that includes an oximeter, so you can track your oxygen levels. It includes a thermometer, so you can track your symptoms. It includes masks and hand sanitizer, as well as toilet paper, soap, some snacks, and then some just nice leisure time activities, so coloring books, things like that, so that you can have the best possible isolation experience. And so our hope is that sometimes people will receive these boxes before we're even able to call them. So if you get this box, it will have information about what it means to isolate and how to do that safely. We ask that you contact us if you have any questions using the helpline. That number is 502-912-8598. And really, this is kind of a gift of support from us to you to thank you for everything you're doing to help keep yourself, your family, and your community safe.
Thank you, Rebecca. Is this something that's in practice in a good part of the country now?
I think there are several cities that are doing it. I wouldn't say that it's widespread, but we have been able to use the federal CARES funding that we've received to provide this additional support to our community.
Good. And so somebody can either call our COVID line and request, or else we know about them through our public health tracing efforts and follow up. Is that how this works?
Yes, we will know when you go out and get tested and you test positive, your result will show up in our system. We will use that result to make sure that you get a care kit. If you have any questions about what it means to isolate safely, if you want to know about your care kit or any other information, please feel free to reach out and call us. If you get a positive result and you have not yet heard from our contact tracers, you are welcome to call this helpline that's up on the screen and start the contact tracing process so that you can let us know where you've been and who you might be in contact with and who we might need to let know that they need to isolate or quarantine as well.
All right, good. Well, you saw the number on the line. Call 502-912-8598. 502-912-8598. Okay, well, thank you for the update on our care kits and everything the Center for Health Equity is doing here during this pandemic. All right, I'm going to mention a few things about Lift Up Louisville, and then we'll be happy to take any more questions that come here. I think everybody knows by now, Lift Up Louisville. We started this at the beginning of the pandemic to unite people online, keep their spirits up during the pandemic. And so we've been working with arts and art programs, other cultural organizations throughout the entire time that we've been up now since March or April. And this week, since tomorrow is Veterans Day, Lift Up Lou is highlighting our veterans and our annual Week of Valor. The Lift Up Lou Hero of the Week is the Veterans Club. Congratulations to the Veterans Club. They offer a wide range of services and support for veterans and their families, including equine therapy, career transitioning, family outreach, and a lot more than that. So check out and support this outstanding communication or community organization at veteransclubinc.org. And then on Veterans Day tomorrow, there's going to be several great recognition events happening around Louisville and virtually to honor our veterans for this year's Veterans Day. It's an unusual one with the pandemic. We had a great parade in reverse this past Saturday. So we're adapting to the COVID-19 world. So you can check out Lift Up Lou on social media for a full list of events tomorrow. And then, of course, there's great content on Lift Up Lou every week. And again, a big thank you to our veterans and a special shout out to my dad, my favorite veteran, 88-year-old United States Air Force veteran. With that, Jean, we want to go to any remaining questions from the media.
I think we have covered all of them that are put in there. If any other media have any to add, we'll give you a minute or a few seconds or two.
All right, please do so. And in the meantime, just from a local standpoint, remember you can sign up for a clinical trial now with Norton Baptist Healthcare, University of Kentucky at stopcovidky.com. Report to anybody or any organizations that you feel are not supporting our guidelines by calling 311 or emailing metro.311@louisvilleky.gov, and then follow the governor's orders for red zone communities, which we're in with our incidence rate of 42 per 100,000. So folks, we're just not doing as well as what we need to be doing citywide to get the virus under control. So if everybody would please do their part with the basics, with masking up, with distancing and hand washing, we will get these numbers down and get them together as the vaccine starts coming gradually to us, but that's not going to be any type of instant solution. We're going to be masking up for quite some time as we head into 2021. So with that, I say thank you for joining us today. Everybody, please be safe, practice the COVID guidelines, and we'll see you next time.